Hello again. Now, we've talked quite a lot about the psychological challenges that people living with diabetes face when they're first diagnosed, in coping with the condition. But what we haven't talked about is the psychological impact of the use of some of the many devices that are associated with diabetes. And to talk to me about that is Linda Gonder from the University of Virginia. Hello.
Hi.
So tell me, what psychological challenges are associated with the technology rather than, if you like, the emotional response to the diagnosis of diabetes or living with diabetes?
Use of diabetes technology really is just a part of the overall demands that diabetes places on the individual in terms of self-management. There are actually interactions with psychological factors at every phase of diabetes technology utilization. There is adoption, the decision to use technology, then the continued use of technology and maintenance. A lot of people discontinue using technology within a few months after starting it. And then finally, there are the psychological implications of the outcomes of using diabetes technology. Most of the research focuses on the glycemic outcomes, whether or not people are able to get better diabetes control. But a lot of our research focuses on quality of life outcomes and whether or not technology improves other factors in people's lives.
That's really interesting because it's kind of assumed that, if the glycemic control is obtained, then that's a done deal, then of course people will be happy. But actually, living with technology can be very demanding. This is a kind of trivial example, but, one only has to think of our relationship with printers, where we're all at one time have been ready to throw the wretched things away because they just won't do what we want them to do. And I guess it must be the same for people with technology in diabetes. They must feel kind of enthralled to their technology.
It really depends on the individual. And I think that's one of the important issues that we are going to need to face as diabetes technology use becomes more and more widespread. Some people love using technology. They're technologically savvy. They adapt to it very well. Other people don't. And one of the studies I talked about in my presentation was these different clusters of people, a study done at Stanford that looked at different clusters of people and their attitudes towards technology. And there really is a range from one extreme to the other, people who very readily embrace diabetes technology. And then at the other end of the spectrum, you have people who really don't have any interest in technology and, yes, would find it incredibly frustrating. And I think that's going to be one of the challenges is sort of how to bring more people into the fold and let them enjoy the benefits. The other thing you said that was really interesting is that there's sort of this assumption that if a technology helps improve glycemic control, people will want to use it, and that would be enough of a benefit. The research actually shows that is often not really the case. And one study I talked about showed that with use of continuous glucose monitoring, that what determined the individual's satisfaction with the use of that technology was actually not their glycemic outcome, but rather the outcomes that they experienced in terms of their quality of life, which were a reduction in diabetes-related distress and an increase in hypoglycemia confidence.
And what do those findings tell us about the strategies that we might adopt for the future in helping people adopt technology?
There are several different strategies, and one that I think a lot of people, especially people in, I'm a psychologist, and a lot of people in my field would want to emphasize the kind of one size doesn't fit all. That we do need different approaches for different kinds of people who bring to the table their own personal issues, their own personal barriers to using technology. So we need to understand what the barriers are and to develop programs to support people. And the research points to some things that are important. One, for example, is making sure that people have realistic expectations about the use of diabetes technology. Often it can be oversold in the sense that it's going to be wonderful and you won't have to spend much time managing your diabetes. And these are the beliefs that some people go into use of technology with these beliefs, and it does not always turn out to be the case.
This is such an interesting area. It's really fascinating. And do some people feel that almost, particularly when you have an app associated with technology, that almost like it's a spy? You know, it's there constantly watching you and you can't get away. Is that a feeling that people experience?
Again, it's a feeling that some people would experience very much, and others it wouldn't bother
It
them in
wouldn't
the
even
least
occur to them.
bit.
Yes.
Exactly. But whereas other people would want to make sure that nobody saw their glucose levels, people can have an emotional reaction to their own glucose levels. Nobody's happy when the screen tells you, that you're too high or higher than you want to be. The other issue is, of course, with young people, because now there are monitoring systems that allow parents to engage in remote monitoring, and so they can watch their children's glucose levels while they're at work, which usually younger children, of course, don't mind at all. But the situation can be very different when you get to adolescence and the teenage years.
Imagine having your mum spying on your glucose levels. It's the every worst nightmare, isn't it, for a teen?
Again, it's different from individual to individual, but it certainly could be the case. Yes.
And where do you think this research? Where are the gaps in research in this area at the moment?
Oh, we have so many gaps. We have more gaps than we have knowledge at this point. But that's really in part because of where we are in the development of technologies. As they develop, then the issues and the problems become more apparent. We do need to know a lot more about barriers for people and how to help people get around those barriers. We need to be probably investing a lot more thought and research into developing programs to support people who are adopting a technology. One study I talked about from researchers at the Barbara Davis Center in Colorado. They followed a group of youth after they initiated use of a hybrid closed loop control, which is the device now that's closest to what we call an artificial pancreas. But they followed these young people, and a third of them discontinued use within the first 3 to 6 months of use. And so they looked at what the reasons were, but we need a lot more research like that to help us create and respond to what people's issues are with technology.
So what I'm hearing from you is just because somebody is younger and a digital native shouldn't make you think automatically that they're going to adopt the technology that they're given. And I also wonder, you know, often people with diabetes are stigmatized enough as it is. And if you blame them for not being able to get on with or work a particular technology, it must make them feel even worse about themselves and about their condition.
I brought that up in my presentation because I think that's something that we have to be very mindful of as we move into the future. We're not at the point yet where the majority of people are using all the various technologies that are available. I think as we get closer and closer to that, there is a real danger in becoming judgmental and blaming people who perhaps do not want to use technology for whatever reason. They choose not to use it. And another at-risk group for that kind of negative judgment might be people who use technology but still don't achieve the kind of near perfect control that technology is trying to reach.
Linda Gonder, this is an absolutely fascinating area, and thank you so much for being willing to come and talk to us at ESD TV about it. It's been really appreciated. So there you have it, an interesting aspect of the psychological impact of diabetes that perhaps people might not have considered before, but which really does need to be part of the considerations when working and treating people living with diabetes. Thank you so much. There's more to come.